Immunization adverse effects. So to ask a few questions, what is the adverse effect of the hepatitis B? What is the adverse effect? Next, what is the adverse effect in case of the Japanese encephalitis vaccine? Then, what is the adverse effect of the yellow fever? Yellow fever, what is the adverse effect? So we'll find out the answers to all these questions and learn a lot more. So firstly, we look at the BCG. So BCG vaccine, looking at some of the common reactions is that it can cause the local pain as well as swelling. Then looking at some of the rare complications, it can lead to the BCG osteitis. Next, also the suppurative lymphadenitis. Next, there is also the disseminated BCG infection, which may be associated with the BCG vaccine. Next, we jump on to the hepatitis B. So the hepatitis B is nothing but there is a local reaction as well as there can be presence of fever. This is the most common in case of the hepatitis B. Then we move on to some of the rare. So rare is that it can always be associated with the anaphylaxis. Next, we move on to the inactivated influenza. So the inactivated influenza, the major reaction is nothing but there is a local reaction. And looking at the rare complications, the rare complication is that it can lead to the Guillain-Barré syndrome as well as the ocular respiratory syndrome as well as the anaphylaxis. Next, we move on to the JE, that is nothing but the Japanese encephalitis. So this can lead to the major reaction is that there is local reaction as well as the low grade fever as well as the myalgia. Then what we see is in case of Japanese encephalitis, there can also be some minor effects such as the neurological events. So neurological events such as the encephalitis. Then we look at the measles. So what about the measles? Measles and the MMR. So mainly measles and MMR, it can cause the local reactions as well as presence of fever and the malaise and irritability. Next, we look at the other minor causes of measles. The adverse effect, it can include the febrile seizures, then arthralgia, as well as the thrombocytopenia. Next, we look at the yellow fever. So in case of yellow fever, the main adverse effect is presence of headache. Next is flu-like symptoms. Then comes the local reactions as well. So what are the minor adverse effects with respect to the yellow fever? It can lead to the vaccine associated viscerotrophic disease. Then we look at the oral polio. So what is the oral polio? So the adverse effect, mainly there are no adverse effects, and if at all it is there, it can be due to the associated paralytic poliomyelitis. Next, what we see is the DPT. So DPT, can cause the LR, that is a local reaction, as well as the presence of fever. Then in minor aspects, it can lead to the neurological events. So these includes the presence of seizures. HHE, that is nothing but the hypotonic, hyporesponsive episode. Next is the anaphylaxis as well as the persistent, inconsolable screaming. So these are the minor aspects of the DPT. So now to answer our questions. So firstly we had asked what are the effects of the hepatitis B. So the hepatitis B, the harmful effects, it includes the local reaction. Next, it also includes the presence of fever. So some rare, it can lead to the presence of anaphylaxis. Then we look at the JE, Japanese encephalitis. So this can lead to the local reaction as well as the low-grade fever, as well as the presence of myalgia. Then we look at some of the rare. In case of Japanese encephalitis, rare is that it leads to the neurological events, and such as the encephalitis. Then we move on to the yellow fever. This was the third question we asked. So in case of the yellow fever, it can cause the headache. Next, it can also lead to flu as well as some symptoms and the local reactions. So other thing to note is that it can also lead to the vaccine associated viscerotrophic disease.
Hello everyone, this is Dr. Hub. Now let me tell you our story. Running with us, we are sure you will reach your destination with ease.